Good morning, everyone. I'm Cynthia Tseng, partner at Fairview Capital. It is my pleasure to welcome you to our series of interviews with thought leaders to discuss topics most relevant to society today and how it also impacts the way we invest. Today, I am pleased to have our guest, Annie Case, principal at Kleiner Perkins, to help us unpack an emerging investment sector, which is mental health, but more specifically, how mental wellness technology platforms can be part of the solution to address many of the shortcomings in the current system. Annie, thank you again for joining us. Before we get started, can you tell us a little bit about yourself and also your background as a consultant, then working for Uber, and now as a principal at Kleiner Perkins?
Sure, thank you. Thanks so much for having me. I'm excited to be here and share a little bit more about my areas of focus at KP and how we think about mental health and mental wellness. I joined KP about 2 years ago. I was at Uber most recently. Prior to this, I spent about 2.5 years there, both in San Francisco and also in Amsterdam. I actually spent 6 months with Uber based in Amsterdam, helping to launch new markets for the Uber Eats business, which was a bit different, but super fun. And I started my career at Bain & Company, the consulting firm based in San Francisco as well, working on a mix of private equity, healthcare, and retail areas. So it's been great to be at KP. At KP, I cover investment areas across digital health and consumer and marketplaces as well, but excited to dig more into the digital health side of things today and mental health specifically.
Great, thank you so much. And I know you've written or been interviewed before on this topic, but can you just tell us kind of some of the areas the current mental health system can do better in terms of obstacles facing the industry?
There are so many. Yeah. You don't even know where to start, I think. When I think about areas of investment for healthcare, I often think about cost and access and quality as three of the big ones to try to get the best mix of all three. And if you think about those areas when it comes to mental health, we clearly have an access problem. There is a massive shortage of mental health professionals across the country, and in some states it's worse than others, but really in any state, just the number of licensed providers of mental health services relative to the number of people in those states is just far too low. So there's definitely an access problem. I think from a cost perspective, it costs the system so much to treat mental health illnesses already in this country, and we've seen them only get worse. I think when I dug into the space a year and a half ago now, we were spending as a country over $200 billion a year treating mental illness across different levels of severity. And we saw that about half of Americans at some point in their life would have a mental health issue that needed to be addressed. And so it's just an enormous cost to the system. And people were often paying out of pocket for that. So, super expensive to see a therapist if your insurance company doesn't cover it, which in a lot of cases they don't or haven't in the past. And there wasn't much on the through employers that was available, even 2 years ago. And that's starting to change and is one of the things we're excited about. But the cost has just been prohibitively high for the vast majority of folks over the last decade and more. And then I think quality, hard to measure in this space, certainly, which is one area that we think about in our investments relative to other areas within healthcare, like diabetes or areas where you have really great consistent data. So that's been an issue as well, is just saying, what does a good provider look like? And then also, what do good outcomes look like? How do we measure outcomes over an extended period of time for people who are engaging with the mental health system? So across all three areas, lots of room for improvement, right. Lots of issues that still exist today, but I think that creates a lot of opportunity for the companies that are starting and trying to tackle this space.
Yeah, and during the pandemic, I understand there's been some regulatory changes. Do you think those will have lasting impact on the wellness industry or mental wellness industry?
Yeah, it's been an ongoing debate with anyone who spends time in healthcare, like which of these regulatory changes will stick and which may go back to the way it was before. I think depends on the day where people land on each individual one, but I think there's a general consensus that these changes have helped far more Americans get way better, faster, cheaper access to healthcare services broadly, not just mental health. Mm-hmm. And so rolling that back would have negative impacts on that. I do think some, folks have talked about HIPAA compliance being relaxed a little bit, the way, data is shared and privacy is maintained. I think that's one where you may see it go back to more of what it used to be, just in terms of protecting patient information. It's still, I think, I would say protected today, but they've just made it a little bit easier to share data across entities so that people can stay home and receive care. But I do think the regulatory changes are around Medicare and saying you shouldn't need to have an in-person visit with someone before you can transition to having telemedicine with that same provider. And you can actually start your interaction with the provider through telemedicine. That makes a ton of sense to me and feels like there's no reason why that should go back. You should be able to access medicine however is most convenient and cost effective and efficient for all involved. So that one is one that I'm hopeful will actually stay, and feels like there's good tailwinds around that being something that stays after the pandemic.
That's great. And so just in terms of the usage of technology and potentially artificial intelligence in the near future, how do you think that can alleviate and solve some of these legacy issues that's inherent in the system today? More specifically to mental wellness.
Yeah, it's a great question. And I think the healthcare industry has struggled with how to best utilize the advances in artificial intelligence, specifically in healthcare for a number of years now, where it feels like we're starting to see it crop up in other industries. Like, what does that mean for healthcare? I've seen all sorts of creative ways to try to do that in mental wellness. I think the most, from the most mundane to the really exciting, but I think maybe, still be a few years out in terms of that being widely adopted, which is actually replacing human therapy with AI. So if you could imagine saying, instead of having, many telemedicine solutions today for mental health, say, I'll connect you at home with a therapist to have talk therapy as it would have existed, 10 or 20 years ago, but do that over video instead of in person. So that's, I think, the most basic advancement. But if you think about the opportunity for AI in that, I've seen a company even a couple of months ago that is saying, you don't need a human in the loop at all. Like, what if we could build AI that could say, you could say, I'm going to start my telemedicine visit, and instead of meeting with another human, you're just talking to AI, and they're prompting the next questions. They're helping you surface things within yourself, just like a therapist would. But that whole talk therapy session could be done with AI and not with a human in the loop. I think we're still a few years away from that working well, and there are a lot of risks associated to that, and not having a licensed therapist on the other side, and maybe not getting it right in terms of the way that they respond. But I think that's a super interesting area that we'll continue to see more companies tackling, and hopefully over the coming years we'll find a way to have AI, even if not replace the human therapist, be able to augment them and reduce the burden that is currently placed on therapists today.
Yeah, I mean, it'll certainly eliminate cost. I can imagine. Yeah.
Or just make it, and I think, we talk a lot about automating work, and I don't see this as one where, therapists will be out of a job because AI will become therapists. Absolutely not. I think the idea that AI could augment the existing therapists and say, maybe between, you have sessions in person with someone or over telemedicine, once a week, but for your therapist, it may be helpful to say, like, actually, you should be documenting these thoughts and thinking about how you're feeling and saying that out loud, because the verbal awareness can be so important every day or, twice a week. So maybe between sessions, instead of relying on me to always be the one, coaxing these things out of you, like, talk to this AI, and we can, then review the what you said and what you shared between sessions in our next session. So I think just giving, more access, more continuous access at a lower cost would be pretty interesting.
Yeah, no, I think that makes a lot of sense. It's almost like this daily maintenance of making sure that that you're documenting and thinking about about these thoughts that you're having. So this is a pretty new category with many subcategories and with different approaches and business models. So I think it would be helpful for our audience if you can, segment the landscape for us.
Yeah.
And then in your opinion, talk a little bit about the different subcategories that are the most interesting to you. And then also ones that you're avoiding right now.
Yeah, totally. there's so many different ways to segment the mental health space. I think there are a few I think important starting points. One is just technology and the role technology plays in it. I think there are a number of solutions that are, very low tech, and then up through, the very high tech AI companion that I just talked about would be more on the kind of cutting edge, very, very much a tech product. On the lower end of the spectrum, and a type of company we've seen a lot of over the last few years is doesn't really have technology at the core, but is using technology to help more people, realize they exist, use digital marketing, do online booking, but are the companies that are creating really, clinics for mental health, new versions of these clinics, which are, brick and mortar facilities. Many of them are tackling these in New York or LA or San Francisco or these hotbeds. I think that's super important work and super interesting, but for us, we typically get a little bit less excited about the brick and mortar component. The real estate footprint feels just a bit less scalable, in that you will only grow as much as you can, add new facilities. And so we like, if you think about the where the company falls on the technology spectrum, we like to push more into, the higher tech, the better, and really leveraging technology to change the paradigm and offer a really new solution. So that on that spectrum, we tend to favor, more of a tech component or tech at the core. I think another way to think about it is the population that you're targeting. There are different companies tackling, children's mental health. There are a ton of issues in mental and behavioral health, whether it be autism or just basic mental health, but targeted towards teens or younger kids, that require a bit of a different setup or different solution than adults. I think the employee base is another one. Knowledge workers, I think we're seeing a lot more attention paid by Fortune 500 companies and other employers to say, what are we providing our employees to help support their mental health? And that would look a little bit different than, for kids or for an adult with more serious mental illness. And then there's a whole other category of companies focused on serious mental illness. So not something that you would find as a benefit provided to every employee at a company. But, if you're dealing with PTSD or OCD or bipolar disorder, there are companies that are building solutions that are tailored towards that and a little bit higher touch. So I think that the population that you're targeting, you see a lot of different innovations there as well. And then the business model, I think, is another piece, and obviously is based in a lot of ways on the population that you're targeting. But we see different companies going direct to consumer and saying, book telemedicine therapy visits with us, or, a Row or HIMSS model of come to our website and we can help you get connected with a therapist to give you antidepressants. That's the consumer piece. We see a lot in the employer channel. Our investment in Modern Health, which I think we'll talk more about in a little bit, is in that space, and saying we're going to get distribution through employers because employers care about providing this as a service to their employees, helping keep them healthy, helping keep them engaged and productive. So that's been a really exciting channel for us. And then, of course, payers. So, selling directly to the insurance companies to say they have this as something that they can provide to the members in their network.
Mm-hmm. Yeah, and since you brought up Modern Health, if you can tell us kind of, highlight, what they do as a business, and then also how did your team decide to invest? I believe this is one of your first mental wellness investments. Yeah. So how did that become, how did this become a theme for KP? And then also your decision to invest.
Yeah, absolutely. So first, what Modern Health does on the spectrums that I just shared, Modern Health is, more on the tech side. They're really using tech as a core component of their product. They don't offer in-person visits, and they are targeting the employer channel. So they are a mental wellness platform that they sell to employers, that employers then make available to their employees at no cost to the employee. And what we thought was really interesting about what they do is they offer everything from very basic kind of self-care, maintenance, mental wellness in the form of meditation content, or things that you can read or listen to engage in your own mental health, up through the more serious, you have a diagnosable issue with depression or anxiety. And so they can connect you with an in-network licensed therapist to really address that problem. And then in between, which is where actually most people fall in the employee base, is digital CBT courses and coaching. So, you're not in a place where necessarily where you need to see a PhD for true therapy. You're not saying you're depressed or anxious, but you want to be proactive about your mental health, and you want to have a coach who holds you accountable and is available to talk through issues as they arise, whether they be financial or interpersonal or at work. And so, you can chat with and get on the phone or video with a coach who will help you through that. So we thought it was really interesting that they, instead of picking one point solution and saying, we're a meditation app, or, we help you connect with a therapist, it was saying, wherever you as the employee are on your mental health journey, we have a solution for you. And so, and you can move between those options really fluidly. So it's been helpful to see the way the employers have engaged with this by saying, yes, like finally there's something that, we don't have to buy 3 different solutions. We buy one thing and it can address every one of our employees' needs for the most part. So that's what they do. How we got excited about them, I think the first is just, we got excited about the space because of all of the underlying issues that we talked about, the access, cost, quality, and how much the system spends on mental health for the results that we have. So knew it was an area that was ripe for disruption. But we really got excited about this solution in particular because of the founder. Allison, the founder of Modern Health, is amazing, incredible. She has a background in healthcare. She was at Collective Health before, so really understood the employer channel. And we always look for founder market fit, and she clearly had it. And she felt like this was a gap in the market at Collective Health. She also has, both of her parents are in medicine, so she understands what the landscape looks like and what the needs are. And so just the more we talked to Allison, the more we felt like this is the right founder. She totally gets it. And this is the right space and approach, in that employers can access far more people than you can in a consumer model. And she was doing it in a really smart way by saying, it's not just one thing. We can meet you where you are and provide everything, which is what the employers are looking for.
Assuming that this is a really exciting time for you and your team to be investing in this space, what are some of the critical steps that these founders have to take, along with their constituents to get this right, so that this becomes a sustainable space that VCs and other investors can continue to grow and build over time?
Absolutely. I think one thing that we just talked about is just founder market fit. I think because the space is heating up, there are more dollars going into it. People are talking about it, and it seems like a really exciting space right now. You may see founders coming into it to say, wow, I think this is a great opportunity to build a big company. And we always caution against that a little bit, just because, if you look at any space, the founders that tend to be successful are the ones who've obsessed about this problem for a long time, have some sort of personal connection to it, whether it be they've worked in the space before or have had, personal challenges in the space. So I think one is just, does it actually make sense that this founder is tackling this problem? Because that's something that we look for, and I think is what will drive the founder to be able to, run through brick walls to build something that lasts, versus say, it didn't work out the way that I'd planned, and run from the space. So I think that's one. I think the other super important one in this space is just getting the business model and the unit economics right, particularly when so many of the solutions today are connecting end users with a therapist in some capacity, whether that be a social worker or a life coach, or a true PhD in psychology, and who can provide these therapy sessions. It's costly. There's a human involved who needs to be paid. So I think it's really important to think about how are you going to deliver this service in a way that is cost effective, and that you can make the economics work as a business, because it would be very easy to say, we want to give more therapy sessions to more people. And that can snowball quickly if you're not aware of what every hour of therapy that you're providing folks, like what is your cost basis, and what are you getting reimbursed for that, or how much is coming in the door for that. We've seen a few companies that hasn't worked out because that part hasn't been ironed out early enough on. And then the other piece is just picking the right channel to sell through. There should be a reason why you're deciding that your solution is best through a direct consumer channel or through employers or through payers, and that you have the experience to lean into that. For Modern Health with Allison, she had spent 2 years at Collective Health, where she was an expert on what self-insured employers are looking for. So that area really made sense for her to say, I'm going to go sell to self-insured employers. If you're an engineer or product manager leaving Facebook or Google to build something like this, maybe a consumer angle makes more sense because that's the area that you know well.
Right.
So I think that's the other piece that's worth thinking about if you're going to start a company in this space.
We really appreciate you spending time with us today. And before we go and sign off, I just want to ask any predictions in this space in terms of what's to come, what might be outrageous, but will actually be normal in this space. Is it a certain model or even a piece of tech that we have not seen?
Yeah, absolutely. I think we are just in the early innings of this space, to be honest. When we invested in Modern Health 18 months ago, the biggest question we had was, this is a great solution. It makes so much sense. This is, there's so many problems in this space, but will employers actually pay for this? Like, that was a very real diligence question that we had to think through because it wasn't being done really before. Already 18 months later, you're seeing that happening, and employers are like, we have to have something in this space, particularly with COVID and people being socially isolated and economic stress and so many other factors. But that's really become the norm or a norm, even in just a year and a half. I think if you play this out into the future, I think it's not unreasonable to predict that everyone will have some form of therapy in their lives, whether that be, you're going to a therapist every week and having an insurance company or your employer pay for that, or, one of these AI models where you're saying, I want to go a step beyond meditation, which is just one direction. You listen to it, it happens within you, but it's not really documented anywhere. It's not a conversation. I think in 5 or 10 years, everyone will, not everyone may choose to engage in it, but everyone will have an option to do something more interactive in terms of caring for their mental health, whether that be chatting with an AI who helps them understand and uncover things that they're feeling or going through and document that, to full-blown therapy. But I think we'll just continue to see the stigma being removed, as it already feels like it has a ton over the last few years, and a lot more people feeling like this is a super core part of who they are and their well-being. And just like it is so normal to go to the gym and work out or go for a run and take care of your physical fitness, I think people will start to view mental health in the same way. Of it is, I went to the gym today for my body, and I meditated or went to a therapist today for my mind. And I think those two will become very foundational building blocks for people in achieving their best selves.
Your point, yeah, definitely. Mental health, physical health, exactly. They're building blocks of who you are, and so you need to really take care of yourself, especially during this period of isolation, where we're where we're just confined to a small space or just a small group of people, daily. So again, thank you, Annie, for taking time to talk with us today, and also just want to thank, KP's partnership with Fairview. And we're really looking forward to continuing this conversation and seeing the growth of this investment and other mental wellness investments in the future. So thank you.
Yeah, thank you so much for having me. It was super fun, and excited to continue to work with you all as well.